So at this time, for this session, Vasanthi and I would like to share with you the two most recent publications OSSU has released. The first publication is a report stemming from OSSU's policy roundtables that featured the work of OSSU's Phase 1 Impact Awards. Essentially, OSSU held 5 policy roundtables that featured the work of 15 Impact Awards. And the Evidence Alliance worked with the information presented at these roundtables, policy roundtables, and the advice provided by the multi-sectorial participants to create summary reports for researchers to use as part of their knowledge mobilization strategy. So the first report, entitled Identifying and Maximizing the Impact of the OSSU Demonstration Projects, represents a compilation of these reports representing over almost 2 years of work. So now I would like to ask Tina Fahim to say a few words about the report and process. And Tina is a scientist for the Knowledge Translation Program at St. Michael's Hospital, and she leads the team for implementation, evaluation, and sustainability. So over to you, Tina.
Thanks so much, and thanks for having me here. So I'll just speak a little bit about the Research Roundtable initiative. So as you said, this was a collaboration between the SPORE Evidence Alliance and OSSU, and we at the Knowledge Translation Program were actually engaged by the SPORE Evidence Alliance to support the development of this report. So I'll spend a couple minutes just talking about the report, but I just wanted to first thank our fantastic team who's been working hard on this report since September of 2019. And specifically, I want to thank Jeanette Cooper, who was the lead research coordinator on this project, for her tremendous work in leadership and for seeing this work through to completion. So I won't take too much of your time today. I'll just tell you a little bit about how we coordinated the data and compiled it for this report. So as you all know, OSSU initially funded the 17 Ontario-based research projects that were designed to demonstrate meaningful approaches to conducting patient-oriented research. These projects were disseminated in the CMAJ supplement, and as the projects began to wrap up, OSSU wanted to provide research teams with an opportunity to showcase these studies and to disseminate the findings to the relevant audiences. And so the Roundtable initiative was meant to engage relevant stakeholders in the healthcare system to provide a platform for dissemination and collaboration between stakeholders and researchers. So what we did is we held 5 roundtables between September 2019 and October 2021. They started off in person, then of course we pivoted to Zoom during the pandemic. 15 projects were presented across these roundtables, and the audiences for the roundtables included representatives from provincial and municipal governments, patient partners, nonprofit organizations, professional organizations, hospitals, universities, and research networks. So it was really a diverse group of people who were attending. In advance of each of the roundtables, we asked the teams to complete a knowledge sharing template, and that outlined their project objectives and the results. And we transformed these templates into one-page plain language summaries, and these were generated for each of the projects and circulated to roundtable attendees prior to the meeting. And then at the event, research teams provided a brief summary of their project, and then we had a facilitated discussion that followed. So then our team took detailed notes of these discussions, coded them qualitatively using thematic analysis, and presented them as you'll see in the report. So it was absolutely wonderful to see the diversity of the projects and just how that common thread of patient engagement shone throughout. Overall, the project teams were able to identify opportunities to disseminate their findings to the relevant audiences. And it was really fantastic to see the discussions about addressing potential solutions to overcoming implementation challenges and honing in on those dissemination messages that teams should focus on. So the participation of the stakeholders really was an interesting format for knowledge mobilization, and provided the project teams with an opportunity to draw upon a wealth of experience, to learn what other teams were doing, and then to really tailor their dissemination plans to maximize project impact. So as Dean announced, our full report is now accessible on the OSSU website, and we hope that it'll continue to generate discussion to facilitate dissemination and implementation of these impactful studies, and of course to continue to generate momentum for patient-oriented research. So thanks again for having us and for profiling the report, and it was an absolute pleasure working with OSSU on this.
Thank you, Tina. It was a great pleasure working with the Evidence Alliance, and I think it was one of the best investments CIHR has done for SPORE as an initiative. Thank you again. I would now like to tell you about our second publication, Empower. And basically, we went to Longwoods to ask if they would be interested in doing a supplement. They were most enthusiastic about what we had proposed. And you will hear a lot more about Empower through the day. Empower basically is engaging multi-stakeholders for patient-oriented research with wider effects and reach. So you will hear 2 sessions, rapid fire sessions on Empower, and we'll be able to understand better what we're trying to do. The articles presented in the Longwoods supplement share the successes and challenges associated with patient-partnered knowledge mobilization and serves as an evidence-based platform on patient partnership in research and knowledge. This is beyond all the articles that the authors who were recipients of these awards have published in journals such as Lancet, all the way to CMAJ. So this is a complementary piece. The team at Longwoods was led by Diane Foster Kent. Our great thanks to Diane and her team for the exceptional working relationship we established, and they produced what I think is a very apt product for this project initiative. You can find the Longwood Special Edition, as well as the link to 3 podcasts that they have produced on this, and they were released on the 26th of September. The podcasts were from the authors discussing their experience with patient-oriented policy roundtables, reported in OSSU's website, and it's in our resource section. Dean, would you please continue with the program?